So today we continue with our series on abdominal imaging with a very interesting presentation done by Dr. Soma about multiple liver lesions. Last week we talked about solitary liver lesions. So in order to have a full coverage, we will do multiple liver lesions at the same time.
Hello everyone, my presentation is about multiple liver lesions. You may notice some overlap with the previous week's topic, solitary liver lesions. That is because the same lesions may present as multiple lesions as well. One of the most challenging aspects when facing any liver lesion is to differentiate whether it's benign or malignant. However, generally speaking, benign lesions tend to have sharp margins and they are homogeneous, while malignant lesions have irregular borders, inhomogeneous. Also, they have peritumoral edema and necrosis.
Excellent.
One of the most important imaging investigation of the liver is dynamic contrast enhanced CT and MRI of the liver. So I'll explain this procedure briefly. First of all, following rapid injection of contrast, IV contrast, images are immediately obtained during the hepatic arterial enhancement. As we can see, these are the hepatic arteries. So during this phase, the hepatic arteries are maximally enhanced while the liver is of low density. Then images are obtained during the portal venous phase of enhancement. As we can see here, the portal veins are enhanced while the hepatic artery is lower density.
See, here it was not enhanced.
Yes.
Here it's enhanced.
Enhanced, yeah.
Good.
And since the liver receives 2/3 of the blood supply from the portal vein, so it will be enhanced as well. So we can see the hepatic parenchyma is more enhanced as comparison to the previous picture. Then comes the delayed phase or washout phase. During this phase, the vessels and the liver return to their normal and enhanced state.
Well, uh, for the less experienced ones, the best or the easiest way to differentiate whether this is an arterial or venous phase, look at the spleen. If the spleen is showing this pattern, the zebra pattern, this is arterial. If the spleen is like that, it's either portal or delayed, but it's not arterial. So if you have this appearance, this is arterial. Right? To be easier, I need to differentiate. Trick.
So these are some of the common hypervascular lesions like hemangioma, focal-nodular hyperplasia, hepatic adenoma, hypervascular metastasis, and also in cirrhosis, the most common hypervascular lesions are hepatocellular carcinoma and dysplastic nodules. Now, coming to the most common cause of seeing multiple liver lesions is metastasis. So, metastasis of the liver is the number one most common cause of seeing multiple liver lesions. And as we know, regarding the malignancies of the liver, metastasis is 20 times more common than the primary malignancies of the liver. And they are very variable in their presentation. They could be solid, cystic, necrotic, hemorrhagic. Next slide, please. So, based on dynamic contrast enhanced CT, we can classify metastasis as hypervascular or hypovascular. Hypervascular metastasis, as the name implies, these are lesions that don't receive their blood supply from the hepatic vessels, so they will appear as low density on contrast enhanced CT. So, this image is taken during the portal venous phase. As we can see, the liver parenchyma is enhanced, while we see multiple areas of low density. So these are the metastases.
And they are almost all of them are ill-defined. They are not very clumped.
Yes. Now, hypervascular metastasis, these, as the name implies as well, receive their blood supply from the hepatic arteries, so they will show enhancement on contrast enhanced CT. Like this lesion, we can see it's taken during the arterial phase of enhancement because the aorta is enhanced.
Yeah.
Yeah. So we can see a lesion that is of low of high density. So this was proven to be metastasis. Hypervascular metastasis most commonly originate from neuroendocrine tumors. Now, on ultrasound, there are variable patterns of metastasis on ultrasound. The most common pattern is bull's eye. I'll explain them on this picture. So this is the bull's eye pattern. As we can see, it is an echogenic center surrounded by an echopenic halo. or it could be echogenic, as seen in this picture, with acoustic shadowing. It could be ecopenic, as seen in this picture, with a posterior enhancement. Now, the second most common cause of seeing liver lesions is benign liver lesion is cavernous hemangioma, and in 10% of the cases they could be multiple. So it's not that commonly multiple. However, it is one of the most common causes of seeing a benign liver lesion, and one of the characteristic features of this lesion is that the blood flow within them is very slow. That is why they have a characteristic enhancement pattern. On contrast, enhanced CT starts off as a discontinuous nodularity around the periphery of the lesion. Then it gradually shifts to fill the center. They also show delayed enhancement, delayed contrast washout. Now, on ultrasound, they appear as hyperechoic lesions. As we can see, this is multiple hemangiomas, and this is a very large hemangioma. But they show on color Doppler. Last week we said that it shows low
Low flow or hypovascular.
Yeah,
No significant flow on color Doppler in capillary hemangioma.
Yeah. So, hepatocellular carcinoma. Among the malignancies of the liver, hepatocellular carcinoma is the most common primary carcinoma of the liver, and the most common cause in 80% of cases is due to cirrhosis. So, when we have cirrhosis and there is hepatocellular carcinoma, it's challenging to diagnose it when there is cirrhosis in the liver. However, MRI is the most sensitive imaging modality. Next slide, please. We can see this is the lesion. It's slightly more dense than the rest of the liver.
So this is the lesion, and it's slightly hyperdense compared to the rest of the liver. Okay.
Yeah. On the arterial face of enhancement, we can see it shows enhancement.
Okay.
So on washout phase, we can see that it shows it's like it has a capsule with delayed enhancement as well, delayed contrast washout.
So delayed contrast washout is in favor of hepatocellular carcinoma in cirrhotic patients.
Yeah. So the reason for this contrast enhancement is that the tumor shows angiogenesis, new blood vessel formation. So that's why it shows enhancement on contrast patients.
So why? Because hepatocellular carcinoma is the blessed artery. Why the enhancement in delayed phase? Why is not in No, it enhances in arterial phase, but a delayed washout on delayed phase. Yani on delayed phase is still showing enhancement. Why is that? As she said, because of new vessel formation, the new vessels, new angiogenesis, it will give it more vascularity, and they are abnormal vessels. They are not normal vessels. They are deformed. I don't know, they're histologically abnormal. So the blood flow in them is not like the rest of the liver. So it keeps contrast. And like hepatoblastoma. I think hepatoblastoma have the same feature. Yeah, sure. Yeah. All malignant lesions should have if they don't have new vascularity, they will not grow as fast as they do. Okay. Thank you.
It also has some other features as well. As I said, they are surrounded by a fibrous capsule or pseudocapsule in 24% of cases. And also they may show, since they are carcinoma, they may show hemorrhage and necrosis. Also, they have calcification, and they may show focal fat infiltration. Next slide. Now on ultrasound. Diagnosing them on ultrasound is difficult. However, they show prominent vascularity on color Doppler. Next slide. Now, this is a lesion on the ultrasound of the liver. You can see it's large, well-defined, and it is hypoechoic in comparison to the liver. However, when we apply color Doppler on it, it shows prominent vascularity, and this is again due to the neoangiogenesis. And in this picture, we can show that they are hyperechoic. So it doesn't have to be hypoechoic. It's variable. It could be hyperechoic or hypoechoic, and it's large. Now, fatty liver. Fatty infiltration of the liver is one of the most commonly encountered lesions on ultrasound. However, we have three criteria to diagnose them on ultrasound. Next slide. First of all, I will discuss the criteria of CT. On CT, this is a normal liver, and this is the normal density of the liver. A fatty liver is like that. The density is lower than that of the spleen by 10 Hounsfield units. It should be less than that of the spleen by 10 Hounsfield units, or in general, the density of the liver should be less than 40 Hounsfield units. Next slide. Now, on ultrasound, we have three criteria to diagnose them. First of all, the echogenicity of the liver should be less than that of the renal cortex. That is one. More than that of the renal cortex. That is the first one. Second, the portal vein outlines should be indistinct. And third, also the outline of the diaphragm should be indistinct as well.
These are the grades of fatty infiltration of the liver. So it's grade 1 when it is less than the cortex of the kidney. Grade 2 when the portal vein is indistinct. And grade 3 when you cannot see the diaphragm. Each one represents a higher grade of fatty infiltration. You can have liver density that is more than the cortex of the kidney with distinct portal vein. That's grade 1. Grade 2, if the portal vein is indistinct, but you can see the diaphragm. That's grade 2.
Yeah.
Grade 3, if all three of them.
Okay.
Got it?
Now, the reason why I talked about the fatty liver in my presentation is that they have variable patterns of infiltration of the liver. First of all, there could be focal areas of fatty infiltration, as seen in this image. This is a focal area of higher echogenicity than the rest of the liver. Next slide. Or it could be multifocal, in which multiple areas of the liver are involved. Next slide. This is a multifocal fatty liver on contrast enhanced CT. We can see that there are multiple areas of lower density on the hepatic arterial phase of enhancement. The liver on the portal venous phase.
Okay.
Yeah. The liver is enhanced while there are some areas of lower density. So these are the multifocal areas of fatty infiltration.
And cases like that are really difficult to diagnose. By ultrasound, they look like multiple masses. By CT scan, they look like multiple masses.
Yeah.
You do a biopsy and it comes back nothing, just the liver. It's annoying. So the best way to do that, how to diagnose it, how?
By imaging.
Do an MRI.
MRI.
Do a fat saturation or in-phase, out-of-phase imaging, and then you will have your liver without fat and everything will be okay.
So their appearance overlaps that of metastasis.
Yep.
Yeah. Now cirrhosis. Cirrhosis is destruction of the liver parenchyma, which will be replaced by fibrosis and innumerable nodules. So in cirrhosis, we will have nodules, and these are some of the causes of nodules in cirrhotic liver. That could be regenerative dysplastic hepatocellular carcinoma, confluent fibrosis, focal fat infiltration or focal fat sparing, in which the liver is infiltrated by fat, but some areas are spared, or metastasis.
Which do you think is more difficult to diagnose, focal fat infiltration or focal fat sparing?
Equally?
No, not equally. I think focal fat sparing is more difficult. You know why?
Why?
Because it appears hypoechoic. Hypoechoic is more in favor of a tumor or metastasis or focal fat infiltration. It has typical locations, which is like the gallbladder bed and segment 4 and these things. Second, even if you have difficulty in diagnosing it, it will appear hyperechoic. What else very common hyperechoic? Hemangioma. Leave it. No big deal. But the focal fat sparing, it's hypoechoic, and this is a big problem.
Yes. Now, regarding the criteria of cirrhosis on CT scan, first of all, the liver is shrunken, as we can see. Second, there is nodularity of the surface. And third, we can see ascites.
What about the spleen?
Spleen? What about it?
In cirrhosis, you don't have splenomegaly?
Yeah, we should have it.
Huh? At least in moderate stage. Not early stage, not necessarily.
On ultrasound, same features, ascites, shrunken liver with nodularity of the surface. Now, nodules in cirrhosis. As I said, in cirrhosis, the architecture of the liver is disrupted. There will be fibrosis with nodule formation. So we have two types of nodules, and they're extremely difficult to diagnose because they overlap the appearance of malignancy, metastasis, and so on. Regenerative nodules. So the first type of nodules and the most common type is regenerative nodules. They are supplied by the portal vein, and since they are supplied by the portal vein, so they will show no enhancement on the arterial phase of enhancement, and they will be indistinct with the rest of the liver on portal venous phase. So as we can see, there are multiple areas of this is hepatic arterial phase of enhancement, CT scan of the liver. We can see multiple areas of low density, while the hepatic arteries are enhanced. So these proved to be regenerative nodules in a cirrhotic liver. Now, dysplastic nodules are the second type of nodules in cirrhosis, and they are of two types as well. They could be low-grade or high-grade dysplasia. Low-grade are similar to regenerative nodules with the same imaging features, and again, it's difficult to distinguish them, while high-grade are similar to features similar to that of hepatocellular carcinoma. They have increasing blood. They receive blood supply from the hepatic artery. So during the hepatic arterial phase of enhancement, they will show enhancement as well. So this is a cirrhotic liver. We can see some areas of high density. These were high-grade dysplastic nodules.
What else do you see here?
Cirrhotic liver ascites.
Massive ascites.
Massive ascites.
Okay. And?
Splenomegaly.
Splenomegaly.
Now, adenomatosis. An adenoma is a benign epithelial tumor of the liver. And in liver adenomatosis, we will have multiple adenomas, more than 10. They are well circumscribed tumor, and their characteristic feature is that they have high fat content. So this will lead to characteristic imaging finding. Since they have a high fat content, this is an MRI of the liver taken during T1. So we can see a high intense lesion.
Intense contrast enhancement.
Intense contrast enhancement, and this was later proven to be an adenoma. Now, lymphoma.
So what are the typical criteria of adenoma?
They show intense enhancement on MRI.
Yes?
Adenoma? Yeah, due to the
other features in
on ultrasound, they should be echogenic because of the fat content.
Okay.
And on CT, they should be
there should be some loss of signal on in phase, out of phase imaging.
Lymphoma. The lymphomas that affect the liver are infiltrative, and they are usually undetectable by imaging methods. And their feature is that they enhance poorly or even not at all. So we can see a large lesion, hypodense, on an enhanced liver scan. So this was later diagnosed as a primary hepatic lymphoma. Now, hereditary hemorrhagic telangiectasia. Telangiectasia are dilated vascular, blood-filled vascular channels, and thin-walled. They are thin-walled. We can see these are the telangiectasias. They resemble an asterisk, and they are densely enhancing lesions due to the star-shaped, and densely enhancing.
Because they are vessels.
Yeah.
On the arterial
phase of enhancement. Now, hepatic cystis are like cystis elsewhere. They are hypoattenuating lesions, and they could be multiple. No, they have a very well-defined wall. Next slide. Now, this is a benign hepatic cyst, simple cyst. It doesn't have any internal foci of enhancement, and it has a sharp defined wall, well-defined wall, and there are no contents within it.
Sure, no content. Contains fluid.
Fluid, yeah. I mean, nothing at high density. Now, this is another example on MRI scan of the liver. that shows polycystic liver disease as a part of polycystic kidney disease. The liver is infiltrated by multiple cysts of innumerable, and they are variable in size. Now, hydatid cyst, the liver is the most common organ affected by hydatid disease, and the cysts could be single or multiple. The lesions commonly calcified. Now, one of the things to differentiate them from simple cysts is that hydatid cyst wall and septations usually enhance. So this is an MRI scan of the liver that shows an enhancing lesion, will define it. And these are multiple cysts within the liver.
It's hyperintense on T2 because it's cyst.
Yeah.
Okay. Okay. And here you can see the.
And these are the cysts.
Excellent. Thank you.